Welcome to Breaking Through with me, Kristen Ralph Finkbeiner, powered by Moms Rising. We have a powerful show for you today in response to the really terrible breaking news. We talk about what happened with Medicaid, how it came under attack by Republican leaders in Congress and Donald Trump, and what it means for us. After that, we dive into looking into the overall budget reconciliation bill, what it means for our communities, and how we can really take action to change the outcome in the future. After that, we look at Black Women's Equal Pay Day, what you can do to fight for equal pay. And we close the show looking at paid family medical leave, how it's passing in the states, and what we can learn from the states at the federal level as well. We're going to jump right in with our first guest. Welcome back to Breaking Through with me, Kristen Ralph Finkbeiner, powered by Moms Rising. We are joined by a really spectacular leader, Nicole Jorwic of Caring Across Generations. Nicole, welcome.
Thank you. Hi, Kristen. So glad to be here. Obviously, wish it was under different circumstances.
Yes. So the circumstances right now, listeners, viewers, people, are bleak. We just had Donald Trump and Republican leaders in Congress push through a budget reconciliation bill that's really a betrayal of the American people. It's a betrayal of our economy. And one big part of what it did was it cut Medicaid by nearly $1 trillion. People, $1 trillion is unfathomably large. Like, I can't even imagine a trillion. If I lined up 1 trillion popsicles, how many is that? It's a lot. It is a really lot. And what it amounts to, in part, because there's a lot of impacts of this that are negative, but 17 million people are going to lose access to healthcare coverage. And that is huge. Like, if you look at a large city in the United States of America, like a very, very large city, that, maybe 3-4 million people. I mean, this is like so many people are going to lose access to healthcare. And it's not just the people who are losing direct access to healthcare. It's also all of the services. It's all of the hospitals. It's all of the everything that's going to have to close. There's going to be huge ripple effects. So Nicole is an expert on Medicaid. And I just named some of the things that I'm worried about. Nicole, what are you worried about with the Medicaid cuts? Because there are a lot of rippling negative impacts.
Yeah, I mean, I'm really worried and still honestly processing because I think a lot of it will remain to be seen. But ultimately, the issue is that Medicaid does do all the things that you talked about, and Medicaid is this incredibly important healthcare program and the backbones to hospitals, doctors. So many residencies, or almost all residencies, are covered by Medicaid. So many, the health systems are going to suffer. But Medicaid is also so much more than that. Medicaid is really this country's only long-term care system. Medicare does not cover long-term care, and I would be remiss not to mention that this bill also includes 500 billion with a B cuts to Medicare. So you couple those two things together, for seniors, it's going to be huge. It's also a workforce program. Medicaid pays the wages of direct care workers, which is a workforce that has already been in crisis for a really long time. And so those wages are going to go down. You're going to see providers close. It's a rural health program. Rural hospitals are going to close. And so the pain really is going to be hard to understand and is hard to comprehend because the systems are so big. And ultimately, Medicaid is a state and federal partnership. And so these costs, this $1 trillion cut in federal dollars, is going to mean massive stress on state budgets. And states have never invested in human services, especially during times of financial uncertainty, which this bill is also going to cause, because really the only people that it helps are rich people and corporations.
It's beyond awful. And some people are like, oh, it's only going to hurt rural hospitals. Well, first of all, only hurt some hospitals is not good. Like, that's not a thing. You can't only hurt some hospitals. It's laughable. And there are a lot of hospitals of all sizes and all places that are going to have trouble. For example, here I am in the Washington State area. We have a hospital called Harborview. Harborview is a Trauma One hospital. It serves not just Washington State, but Alaska, Idaho, Utah, Montana. If you have a major accident in any of those states, you are coming to Harborview in Washington State. And already they have said that if the cuts that just happened went through, they might not be able to stay opened. And that is the only Trauma One hospital for 5 states. I mean, That is huge. People are not talking about it. So it's
Yeah.
rural states, it's urban states, it's suburban, it is any place that you are. Even if you have private health insurance, you may go to a hospital. You may get in a, heaven forbid, get in a car crash and not have your trauma one hospital to go to. I mean, it's awful. Just
It truly is. Yeah, it's already happening. I just before, as we were getting on, and we're going to see more and more of this, that a hospital in Nebraska was already saying that they're going to shut their doors. So again, these are things that we anticipated, and that's why we've been fighting so hard. And we're just going to have to hold everyone accountable who voted yes on this, because it's going to hurt everybody, and it's going to hurt every district in every state.
And I start thinking about it. I mean, we pay taxes. I love paying taxes. I love being able to drive on the road. I love being able to flush my toilet, people. I love being able to turn on the electricity, clean water, all the things. Schools, I love. Access to healthcare when I have an emergency, I love. This is something that we, as people across America, have paid into our healthcare system. But instead of getting the returns on our payments and our choices and our priorities, because poll after poll shows that Democrats, Republicans, Independents, Libertarians, all the people want access to healthcare. This is not, while we had Republicans eviscerate it, their constituents actually want it. Even though polls are showing that, we're seeing that there was a dramatic shift of my taxpayer money, your taxpayer money, our taxpayer money out of healthcare and to billionaires, giving tax breaks to billionaires. So these cuts are not like, oh, we need to save money. These cuts to healthcare are not like, oh, we're decreasing the national debt. No, they're increasing the national debt
100%.
all to give money to billionaires, more money to billionaires. I could not be more irate. Well, how are you feeling?
I'm irate. I'm also, as a family member, my brother Chris has autism and is going to have a birthday this month and will be 36 and relies on Medicaid. And it's just, those are the things that across the board, across the political spectrum. I'm with a lot of my family right now. A lot of people around this time in the summer are getting together with people. And those folks include people across the political spectrum. I'm related to every political viewpoint, and everyone agrees that those are the things that our tax dollars should be paying for. And so that's why it is so devastating, and why it's so hard to understand, and honestly impossible to understand why anyone would vote for this. It's truly a reverse Robin Hood, taking things from people in need, taking things from vulnerable communities, taking things from every community, just to give more to people who are just they're doing just fine. Billionaires and corporations are doing okay, but there's a lot of families that are struggling, even with the threadbare system that we just tried to defend, and they just pulled the rug out from under it.
There's so many important things in what you said. And one of them is that, billionaires and large corporations are doing just fine. And study after study by economists who are not Democrat, not Republicans, not Libertarian, just actual academics running the numbers, show that when you give more funds to billionaires and to large corporations, you don't get any kind of boost in your economic activity. They just save it in the bank, put away somewhere. But when you have programs like Medicaid, like SNAP, like Medicare, like the ACA, it actually boosts our economy. It doesn't just save lives, which is actually important, saving lives. Thank you very much. But it also boosts our economy because those funds immediately are injected and spent into our economy. So we're also looking at a tremendous amount of job loss across the healthcare system spectrum. Job loss by doctors, job loss by nurses, job loss by home health care providers, job loss by care providers of all types. I mean, we're just looking at so much job loss and life loss, and we're not looking at any overall economic gain for our nation as a whole. The idea of trickle down has been debunked numerous times as it has been tried in the past and failed. It just doesn't happen. So, I mean, part for me of what's so upsetting is that we're doing this just to help Donald Trump's billionaire friends. I'm going to say, like, no, that's not, like, what is happening? No.
Yeah. while taking systems away from people who need it. And just last week, our friends of both Moms Rising and Caring Across Generations, the National Partnership on Women and Families, put out updated data that shows already, before these cuts, $1.1 trillion in unpaid care is being provided to the economy. So then you're taking these systems away to, again, only help the wealthiest few. And then you're just going to make the gaps that caregivers are already feeling bigger, and that's going to come at a bigger cost to the economy. So what they should have been investing in is the care economy, and instead what they did is completely shred the care infrastructure. It just makes no sense for the vast majority of people, because we know that there are 105 million people in caregiving situations. We know that everybody is going to face the need for these systems that they just are starting to take apart with this vote.
It's so upsetting. Okay, I'm going through all the stages of grief. I'm now at anger. And what can I do to turn my anger into change? And what can our listeners and audience do?
Absolutely. I think that it's obviously really important for everybody to grieve the moment. Everybody did so much hard work and left everything on the field. And I think that that's important to acknowledge, but we do have more to do. And that starts with accountability. And we have some really important moments coming up even just this month. So this month, July, is the 60th anniversary of Medicaid and Medicare. So Caring Across and Moms Rising and a lot of our Care Can't Wait and partners across healthcare and across rights and gender justice are coming together for a 60-hour vigil on the Capitol grounds on the National Mall to highlight stories. We're going to have a moment with our faith-based communities who've been so important and key in the fight, to really highlight the stories of the people who will be impacted, and also to start saying, look, we still have this need and we're going to fight for more, and we're going to build something better, and something honestly that they can't even imagine versus what they took away. And so that will go from July 23rd in the evening until the morning of July 26th. And then July 26th, all over the country, there will be these family first events where folks can be going out into your communities or come join us in Washington, D.C. at that same spot on the National Mall, to say that this is not what families need. Families don't want more money for billionaires. Families want care. Families want a long-term care system and Medicaid and Medicare. Families want childcare. Families want paid leave. And what they did is take away from our families, and what we're going to do is build for our families. And so there will be those moments just already this month to start putting a container for the rage that we're all righteously feeling, but also so that we can start collectively building for the caring future that we all deserve.
And you can sign up to be at any of those distributed events or in DC, or participate remotely even.
Yes.
On the Caring Across Generation website, coming soon on Moms Rising, coming soon on lots of different organizations, because we're all in this together. And we are all, each and every one of us, not giving up on us. History shows us that sometimes the pendulum swings way too far in the wrong direction. We are in that moment, and we know that the pendulum that has just swung and eviscerated our healthcare will actually swing back, because it is very unpopular, again, with Republicans, with Democrats, with independents. Nobody likes this kind of annihilation of our healthcare system. And so we are here to say we're not giving up. We're going to pull that arc back towards justice. We know we can do it together, and we want everybody who's involved, listening, watching right now, to be part of this change, because we are a growing, strong, persistent, insistent movement all together. And so how can people sign up? Where should they go? What website?
Everything will be launched and we can share it. But familiesfirst.org is where you can find everything out for the July 26th event. And on the caringacross.org, you can find all the information for the 60-hour vigil. And as you said, it will be on Moms Rising, and all of our partners will also have sign up links. But familiesfirst.org for the Saturday, July 26th event. All of it will be family friendly, but also, most importantly, an opportunity for families to come together to show what pro-family means, and the policies that encapsulates.
Thank you so much for being on. Nicole Jorwic, Caring Across Generations. Thank you for all you do, and thank you for persisting.
Thank you, Kristen, for everything.
We're We're going to take a quick break, but we'll be right back with our next guest who's going to tell what happened in that budget reconciliation bill. What was in the 900 pages of doom? We'll be back in a quick flash. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by MomsRising. We are joined right now by Elyssa Schmier, who is with MomsRising and is going to break down what the heck just happened in Washington, D.C. before the holiday. Welcome, Elyssa.
Hi, how are you?
I am terrible because I am so mad about what happened in Washington, D.C. with this terrible betrayal of a Republican budget bill. It's a reconciliation bill. And there's a lot going on, people. And it is complicated. And sometimes it's complicated on purpose. So people don't realize how much bad policy is being pushed through that undermines our economy and our families. So we're going to take a moment with Elyssa, who has done the most amazing job tracking all of the policy, tracking all of the bouncing balls in the over 900 pages of disastrous missives that just went through. And we don't know everything that's in there. In fact, we probably won't figure out everything that's in there for another whole year because there's a lot awful. But we know a lot of the big things that went wrong in that package. And Elyssa, what were some of the biggest disasters that came through in that package?
Yeah, like you said, it's 900 pages. There's a lot of stuff that's probably snuck in there that we're not going to find out about. There's a lot of things that are going to take a while to be implemented, but we're going to feel pain. A lot of families are going to feel pain because of the big pieces that are in here as well as the small. So some of the top line pieces that were in this disastrous bill is, the biggest thing I think is that it drastically cut Medicaid and the Affordable Care Act, or Obamacare, leading to health care being taken away from 17 million people. And also going to close many hospitals and community health centers, including 300 rural hospitals. And so we know that the healthcare piece of this alone is going to take away healthcare from senior citizens, from pregnant women, from people with disabilities, low-income families, and unfortunately, a lot of children. A couple other things that are in here, it's just a barrel of awfulness, but that makes a historic cut to SNAP, or food stamps, $186 billion cut to SNAP. And enforces a new work requirement and red tape for parents with school-aged children. That's the first time that we've ever seen that. And unfortunately, it continues to make some history in the sense that it shifts a significant amount of federal spending for SNAP to the states. And it also shifts a lot of spending of Medicaid to the states. This is supposed to be a partnership, but the Republicans basically severed that partnership of the federal government and what they provide for healthcare and nutrition assistance to the states. And this is going to force the states to, into a budget crisis. The reality is that they are lying and saying that no one's going to lose food assistance or healthcare that needs it, but the states are unable to pick up the cost of what the federal government is leaving to them. And so that will most likely lead states to cut people off SNAP, or possibly leave SNAP altogether and just not have that program in the states. It also blocks Planned Parenthood from receiving federal funds. This is going to impact the over 2 million women a year who use Planned Parenthood for pregnancy and family planning, prenatal and postpartum services, cancer screenings, mental health care, vaccines, et cetera, et cetera. It's already against the law for, federal funds to go to abortion services. So this is just another way for them to punish women and punish the healthcare and the services that they seek. And then there's a ton in this bill. I mean, this bill is a direct attack on immigrant families. It attacks those who are here legally and those who are here undocumented. The bill blocks immigrants here legally from vital health care services, and then it spends hundreds of billions of dollars, funding ICE agents, funding a border wall, funding separation of families, sending people to prisons in other countries. That was one of the main goals of the bill, is to cut our health care and fund a, immoral immigration policy. The other main goal, and I kind of left this for last, but the whole reason all this was done, the cuts to the healthcare, the cuts to nutrition, the cuts to public schools, the list goes on, is to give a massive multi-trillion-dollar windfall to billionaires. I mean, that is what they were doing. They had to make the pot large enough to fund the tax cuts that they wanted to give to the super wealthy, and they did that by cutting our healthcare and schools.
I mean, when we look at this bill, it is a pile of ridiculous awful. And I've heard some people be like, oh, we have to cut. And guess what? We do not have to cut. This bill, because it gave so much money in tax breaks to bazillionaires and to corporations who are extraordinarily doing well, actually increased the deficit by almost $4 trillion at the last count. I mean, it could go up when they do the final count because, 900 pages. So this is increasing. I'm going to say it again. It increased the deficit by $4 trillion simply to give these tax breaks. We didn't have to cut Medicaid. We didn't have to cut SNAP. Our country did not have to cut public education. Our country did not have to undermine our ability for people to build good lives, contribute to their communities, raise healthy kids. That did not have to happen. The reason Republicans did it was to offset the cost to our country that they are giving for tax breaks for bazillionaires. It makes me so mad. My hair is lighting on fire. People can't see it. I'm going to do like this. This is my hair lighting on fire. Actually lighting on fire with outrage. I'm outraged about this. And I just cannot believe that these Republican leaders who did this can sleep at night. They say that they are against increasing the deficit. They just blew it out of the water by $4 trillion. I mean, this is one of the only times that I'm probably in agreement with some of the really hardcore far right ones who are like, I don't want to vote for this. It increases the deficit. I'm like, yes, it does, because you gave $1 bazillion trillion to billionaires. So mad.
I think that there's a lot of things going on in this, giant bill. And I think to make the math, you almost have to work overtime in order to take such a large sledgehammer to our healthcare, nutrition, safety net programs and still not have savings. And in order to even do this, to give a tax cut of this size, they also raised the debt ceiling, which is the reason why Senator Rand Paul voted against the bill in the first place when it was in the Senate. Because they had to, the debt ceiling is an arbitrary ceiling. I think they should eliminate it altogether. There's no reason for us to actually have a debt ceiling, but many Republicans think it needs to exist. And they think that up until the point where it does them no good. Sorry about my dog. So they think that up until the point that it does them no good. And so they raised the debt ceiling. They slashed all this stuff. They gave trillions of dollars in tax cuts to billionaires, and they still walked away with a higher deficit.
Sorry. I mean, if you could have said, write me a really bad policy.
Let me just deal with, sorry.
We're having a moment with a dog, people.
Sorry, guys. I should have put him in his crate.
It's okay. We can't hear him. It's the noise canceling is happening. That's Ziggy. People who are paying attention. Ziggy is in the background. Ziggy is a whole experience of entertainment and awesome. And so welcome, Ziggy. But even Ziggy's mad. That's where we are. Ziggy is mad.
Really
Ziggy's mad about this. I mean, it's awful. So this isn't the first, last, or only moment where things like this are going to happen potentially and where we need to rise up. We also know that there is a proposed budget coming forward from the one and only Donald Trump of doom that does things already, like puts in cuts for programs involving things like Head Start. So what's your advice for people in taking action? And does it matter when people call their senators, when they call their members of Congress in the House? We've had a lot of activism. And so the question is, does it matter? A lot of people are asking that right now.
Yeah. So it totally matters. I mean, this bill is really, really bad, but there were things that got removed that were terrible too. So there was, Senator Mike Lee had a piece in the bill that basically sold off large portions of federal lands, national parks, basically beautiful, beautiful spaces with gorgeous wildlife that we should be preserving. And there was such an outcry from that they dropped that completely from the bill. I mean, they continue to do other horrible things that harm our environment. But, I think the pressure for stuff like that, we also saw like there are a variety of different reasons why the small amount of Republicans voted against this bill. But I think the pressure and the stories and the feedback they were getting about the Medicaid cuts in particular, I'll name three people in particular. In the Senate, Senator Susan Collins from Maine and Senator Tillis from North Carolina, they both voted against this bill. They had to vote their conscience. It basically is costing Senator Tillis his job. He decided not to run for re-election because, once again, President Trump bullied him because of making the correct decision to not support this bill. And over on the House side, Representative Fitzpatrick from Pennsylvania, who is a person, a congressman who MomsRising has met with many times and been funneling calls and sharing stories and putting a lot of pressure. He knew that this bill would hurt his constituents, and the healthcare piece was just something that he could not vote for, and so he voted against it. So I think that the pressure is on. This is a wildly unpopular bill, and it's only going to get more unpopular the more people learn about it. And I think that we have that on our side because, as you mentioned, the Republicans are not done yet. There are certain things that they could not do in this bill because of the rules of, the budgetary way that they did it, which is called reconciliation. And so there's certain programs that they didn't touch, but they plan to go after in the regular budget process. Believe it or not, they're not done cutting. So Head Start, WIC, more public education programs, veterans affairs programs, a lot of other things they are going to continue to try and cut. And I think that they're going to feel an incredibly strong pushback and have to make changes. And they're going to have a really hard time come September trying to pass those budgets because people already are really angry, really scared, really fired up about what they just did with this, big betrayal bill. And so I think that it's really important to speak out. I mean, we know that it's making a difference up on Capitol Hill. We've been able to turn a number of Republicans. And quite frankly, like they need to know every place they go, 4th of July parade, a town hall meeting, or sitting comfortably in their office, that their constituents are hurt by this and that they're not going to forget and they're going to continue speaking out against it because they should really just feel the pain, the shame, the sting of the bad decision they made, because many of them actively said they either don't know what's in the bill, which was a lie, or they didn't like what was in the bill and they voted for it mainly because of Donald Trump, out of loyalty to Donald Trump versus loyalty to their constituents. And if you ask me, that's something that should cost them their job, and that and all the way up to the cost of their job should be a painful practice in what not to do when you're in elected office.
Yeah. And you started to say we have 12 seconds left. You started to say what people can do just in the last 8 seconds. What can people do more immediately?
If your member of Congress voted in favor of this, call them and tell them how disappointed you are in them. If they voted against it, thank them. Everyone needs to be thanked for their bravery in speaking out against this package.
Thank you so much for being on. Thanks for all you do. Thank you. Thank you.
Thank you.
We're going to take a quick break, but don't go away. Next up, we're talking about Black Women's Equal Pay Day and how we can fight for fair pay for everyone. We'll be back in just a moment. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner. Powered by MomsRising, we are joined right now by a nation-lifting leader, Monifa Bandele of MomsRising. Welcome, Monifa.
Thank you for having me.
I'm so thankful that you're here. We are in a moment where it is Black Women's Equal Pay Day. And I just wanted to lift this up to our listeners, to our audience, to spend a quick moment on what that means. Can you share a little bit about Black Women's Equal Pay Day and the history and the current context?
Yes, so Equal Pay Day is the day when various groups of women earn what white men have earned that previous year. So, for example, if last year someone earned $30,000 who was a white man, then in that industry or field, a Black woman would just be earning $30,000 today if you started from January of 2024. And so throughout the year, we just basically acknowledge the different equal pay days that happen. There's an overall equal pay day, which is the day when women overall earn what men earn, which is a few months into the year. But we always drill down to Black, Brown, and Indigenous and Asian groups because we find that what's happening is there's a gender gap in the wage, but it is also compounded by there being a racial pay gap. And so sitting at that intersection makes basically more than halfway through the year. We are here in July, the day of equal pay for Black women.
And what does that pay gap look like? It's not small. I know that if people sat here and did the math and like, okay, it is actually July. Yes, that is month 7 into the following year that we are holding Black Women's Equal Pay Day. We could kind of imagine there is a big, big, big pay discrimination that Black women are facing. Do you have the number?
Yeah, it's 66 cents on the dollar. So in an industry where white men are earning $100,000, we can see that Black women are earning $66,000.
Ugh, it's awful. Can you share a little bit of the history of why that is happening?
Yes, and I just also want to add is that it translates to a loss of $42,000 annually. And when you think about over the years and over the decades, that really ends up being a lot of lost wages and wealth in families.
I mean, it's awful. It adds up and it also hurts our economy. I mean, it hurts everything. It hurts families, hurts people, hurts the economy, hurts kids, hurts moms. I hate it. I hate the wage gap. How can we get rid of it?
So, we've been fighting year and year to pass equal pay to make sure that that Congress and the president sign a bill that closes this wage gap. We're really demanding that Congress take action. I know that in the last few months, things like equity and equality have become these bad words, but we still need to lean in instead of moving away from the fact that we have to have equal pay across the board in the United States. And so at Moms Rising, we're doing ongoing letters and stories to Congress, letting them know that this is a priority and we're not going to let up. One of the things that people can do most immediately is sign a new petition that we have going out today because it's Black Women's Equal Pay Day. And in that, once you sign it, you can share your story. A lot of people don't realize that they're not paid the same as their colleagues. But recently, we passed pay transparency. And so we find as more and more people are saying, hey, I've been in this job for 5 years, 10 years. I had no idea the person across the hall who does what I do is making so much more money than me. And so this is a time where we want to collect those stories so that we can keep it moving. An interesting stat that we'd like to share too about Black Women's Equal Pay Day is that right now, Black women are amongst the most educated groups in the United States, more likely to have graduate and postdoctorate degrees, and still are really striking out in terms of getting pay equity in the workplace. Some of the things you see that translated into is that Black women are the fastest growing group of entrepreneurs in the United States. So people are like leaving the workplace and starting businesses on their own because of the inability to achieve equal pay.
It's so, how can people get involved? I know that you mentioned go to the Moms Rising website, share your story. What else should they be doing?
Yeah, our stories are powerful. I mean, we've been seeing that time and time again that every time there is a fight and people are fighting in very different ways. Our elected officials will do things like draft bills and vote on them. We have folks that will do mass mobilizations, and we absolutely do that too. But I think that our stories are like our most powerful weapon in this moment because what we're in is a narrative fight. People are saying, oh, it's not true that you need health care, or oh, there's this fake crisis with people who are undocumented voting. Like it's these invisible armies and these false narratives that are emerging about the pretext for some of the policies that we see advancing that are really harmful, and also the inability for policies to advance that we know that are very helpful, like equal pay. And so some of those narratives are just about what's really happening. They'll say women don't want to get equal pay, or women don't want to work, or all kinds of nonsense. So share your stories so that we can tell the truth and we can tell truth to power. I really think that is some of the best ways that we can take action.
Yeah. Yeah. I mean, your story is so powerful. This situation that we're in right now, as Monifa said, where there's a whole bunch of myths going on out there, is also not an accident. There's a ton of disinformation coming from the far right and MAGA. There's a ton of misinformation coming from the far right and MAGA. And that really makes a situation where it all adds up to be a culture of myth. Like it's not true. And so our stories break through the myth because we're like, this thing, that this ridiculous idea that is being pushed by the far right is actually not true in my life. Let me share with you what's happening. And I just think that's so important. And the other thing that sharing your story does, it not only educates leaders about what's really going on, and not only educates the media about what's really going on to help shift and shape the narrative, it also helps people know they're not alone. Like we have a very strong culture also in this country that is awful of blaming people who are being put in positions where there is no structural solution. So, which is ridiculous. You can't blame people for that. So when you share your story, it lets other people know they're not alone, and lets people see that when a ton of people have the same issue at the same time, it's not any one individual's fault. It's a situation that we can and must address together. And often we can do that through policy changes, as Monifa shared. And what are your thoughts?
And that is, it's systemic. And the other thing we see an attack on is the factual, actual history, right?
Oh,
And
yes.
so when we share our stories and we push through the history, if you all sign our petition on our website, you'll see that we talk about the legacy that brings us to this moment of equal pay, and that the promise of the 60-plus-year-old Civil Rights Act hasn't even been fully realized for Black women, but instead we've inherited a labor system built on racial and gender exploitation and separation. So there's also certain job pipelines, right, that just don't lead to higher paying wages, even though you have same skill set, same level of education of people that are in fields that have higher wages. And this has been going on since post-Reconstruction, that Black women have been funneled into low-wage roles that systemically undervalue us and reinforce racial and gender hierarchies. And so it's really important that right along with our stories, we also tell these histories to break through, right, in this kind of like fake news era that we have, so that we can win something that, like you said earlier, really benefits the entire economy.
Yeah, for sure. If we're looking at that long game, Monifa, and looking at this frustrating moment where the Republican leaders are out of step with their actual constituents who are also Republican, much less they're also out of step with Democrats. What's your advice for people to do as we're trying to turn our country around and save democracy and get fair pay?
Absolutely get involved. A lot of us don't realize it, but we are in, social and organizations all the time. Perhaps it is your union. Get involved. Maybe it's your tenant association or your block association. Get involved. Moms Rising, get involved. If you're a teacher, you're a nurse, you're a doctor, you drive Uber, all of these places, there are ways that people are really coming together and getting information. And not everyone's activism looks the same. Don't let anyone shame you or embarrass you in terms of what your contributions are to this moment. Decide of what your contribution is, and you can lean into that. Maybe you do fundraisers. Maybe you show up to events and you MC them, or maybe you provide childcare for them. Both of those things are equally powerful and needed in this moment. So I just really encourage people to get involved and to remember that everyone's activism is going to look different. And we try to kind of curate many layers of the rainbow of engagement at Moms Rising so that you can really pick and say, hey, I want to join this group that does some meetups. That's my speed. That's where I can really jam out and be effective. Or you may say, hey, I want to help pull together the biggest march that my town has ever seen in this next mass mobilization, or I want to do postcard writing. So there's just like unlimited possibilities, but just reach out to us or look around and see what's happening. And then I also want to add that this is a great time for what we call mutual aid. As things are being cut, like FEMA and all the things that we need, there's always opportunity in our community to come together and help shift the material conditions for our neighbors and for other people who live in our cities. Definitely be on the lookout for mutual aid opportunities and join there, because they also become a great field for one, helping people, but also base building and organizing.
So important. Thank you so much for being on. Monifa, Bandele, Moms Rising. Thank you for all you do. We're going to take a quick break, but don't go away. Next up, paid family medical leave. Yes, it's gaining momentum in the States. What you can do to help make sure everyone has access. We'll be back in just a moment. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We are joined right now by a fantastic expert guest, Dawn Huckelbridge with Paid Leave for All. Welcome, Dawn.
Thank you for having me, Kristen.
There has been a tremendous amount of horrible headlines at the federal level, just awful, devastating headlines. We just had the Republicans and Donald Trump push through the biggest cuts to healthcare in the history of our country. They pushed through giant cuts to SNAP. They pushed through horrible policies related to public schools and more. The list goes on. It was like an over 900-page bill of doom. And all of these cuts were just to give more tax breaks to people who are already wealthy, billionaires, and to corporations who honestly didn't have those tax breaks before 2017, so do not still need them now. So these cuts were not necessary in order to, quote, balance our budget. They actually increased the deficit by about $4 trillion doing these tax breaks, and they eviscerated the programs that matter the most. So this is bad. This is very bad. I'm mad. I'm going to stand up. I'm going to keep fighting. I'm going to keep doing all the things. And in this, there's some moments of hope, and that is the states. So Pennsylvania is rising in a good way. And when we're talking about paid leave for all, first of all, we're talking about paid family medical leave and what's happening in Pennsylvania with paid family medical leave that can give us hope despite the doom and gloom in the headlines.
Yes, I will just add on the doom and gloom. I mean, it's taking my breath away, even though we knew this would likely happen. Just the sheer cruelty of it, the biggest wealth transfer, as you said, in the history of this country, robbing working class families, robbing the poor, robbing the middle class to give more money to people who were too rich to begin with. And lots of things, as you said, that are bad, including some fake paid leave provisions that are just another wealthy corporation giveaway. Anyway, I could go on, but it's a sad day. But we do continue to find some hope in the states and cities. And there's something that is really exciting and hopeful that I just want to make sure everybody knows about, which is that there is a bill in Pennsylvania that has bipartisan support. It has the support of 81% of voters in Pennsylvania. It has the support of organizations all across the Commonwealth and all across this country. More than 40 of us just signed on an endorsement letter in the last few days. That number is continuing to grow. And it has the opportunity to move in just the next few days. So this is big. It would be enormous. It would help so many families in Pennsylvania. It would help so many small businesses. And we want to make sure that people are aware of this, that they have the governor's back, that they are encouraging leadership to really move, to rally, and to get this over the finish line. Because what a bright spot, and what, as you said, is a pretty depressing landscape right now.
You recently did some really powerful polling about the way shifting perceptions of paid family medical leave have been impacting people across all genders. And I'm wondering if you could share a little bit about that polling. It was really interesting.
Yeah, we actually, at the same time, we had two different studies that came out, and one was a poll, that looked at, we hear so much about the manosphere and the loudest, angriest podcasters and the loneliness crisis and just sort of this crisis of masculinity in America. And Paid Leave for All, we wanted to kind of dig in a little bit and ask men directly how they were feeling, not just sort of the loud, angry ones on the radio, et cetera. So we did this poll nationwide, and what we found was much more hopeful of a picture than that has been painted for us of the state of men in America. We found that more than feeling angry and frustrated, men did feel hopeful, that they took great pride in taking care of their families and being there for their families, and that was not contrary to the idea of masculinity, but like very connected to it. It was very much a part of it, and it was the top value, being able to both provide for their families, be there physically and emotionally for their families were some of the top values, more than success in their careers or in other things that we tend to talk about more often as being masculine. And across the board, more than 90% of them supported paid leave, affordable childcare, and affordable long-term care, and not just for themselves and their families, but for all workers, all working people in this country. So that was exciting to see, and it was hopeful, again, looking for these bright spots in this, what does feel a little bit like doomsday. We found men wanted government solutions. They supported these policies, that was very core to their sense of pride and dignity and masculinity. And then we also found at the same time, by looking at these state programs, of which there are 14 that have passed, hoping Pennsylvania's lucky 15, that men are actually using them. And though sometimes we hear men face stigma, they don't use paid leave, they don't want paid leave, they want it, and they're using it. And in the newest state programs, in Colorado, they have reached parity. They take parental leave as much as women do. And in Washington state, Kristen, men have passed women. So I thought that was pretty, surprising in some ways, because it's not what we hear about every day, and also really exciting and hopeful.
One of the things I love about the paid family medical leave policy, and as you know, I have a great love affair. So my poem of love for this policy is, a million miles long. But one of the things I love about the paid family medical leave policies is that they are passing at the state levels. And so we're learning a lot. We're getting a lot of data. Like what you just found out, that dads are more often taking paid family medical leave than moms. That's huge. That's changing gender equality. We'll talk about that in a minute. But we're also finding out places like California, where we're seeing that when we have access to paid family medical leave, California is the state that passed it the longest, so there's the most data, that there is a 40% lower need for TANF and SNAP, so other government programs, that businesses love having a statewide paid family medical leave program because it allows them to better compete with businesses of all sizes in getting that highly valued staff into their offices. And, they don't have to pay. A lot of people think this is an unfunded mandate. No, businesses don't have to pay. It's a social insurance program. So businesses are not paying for the paid family medical leave. That check comes from the state in most states where it's passed. And so when we look at paid family medical leave and we look at the passage at the state level, and then we look at the country, and then we look at the world, we see that the United States is one of only 6 countries in the world that doesn't have this policy yet. But there's so much we're learning from the state passage about why it's so good specifically to the United States of America, that I hope will help it finally pass in a non-fake way, like it's moving right now under Trump, at the federal level. And what do you think about the learnings at the state level that could propel it forward at the federal level in a real way?
Yeah, I mean, you always say this so well, that it is just a win-win-win. That it is a policy that is good for bottom lines. It is good for businesses. There's a positive return on the investment in paid leave consistently. It is good for workers and families and public health. It is good for equity and making sure that there's a level playing field for people who want to progress in their careers and be able to be there for families, who want to be able to accumulate a little bit of savings and have retirement and all of these things, enjoy a good life. Paid leave is important to all of that. And so we've found data, as you said, from years of these state paid leave programs, which have helped us actually improve the model, improve the existing programs, create better new ones. And it's informed the policy federally. It's really gone into changes and improvements in the bill we have, the Family Act, which will be reintroduced soon, actually. But I think also, I just want to say, you know, in thinking about this big, ugly bill, what we have learned is that, and it should be common sense, but that investments, which day to day are quite small, month to month are quite small, investments in things like paid leave and other social insurance programs and benefits and things like Medicaid, Social Security, there is a positive return. And it's more than just the money. It's more than just the savings, like you mentioned, of TANF. It's more than just the spending that we're not making in other places, but it is the happier families, the healthier families, the better communities, the better, stronger, more competitive countries. And it's really sad to me that not only have we not quite learned that lesson about the value of investing in our families and our working people, but now we're ripping away the little bit of a social safety net that we had. So we gotta do a lot of work to get some new leaders who fully appreciate that and who have lived it and who continue to fight for it.
100%. When we're talking about the learnings and we're talking about the polling and we're talking about more and more men both supporting and using paid family medical leave, one of the other benefits is that we have found, by we, I mean a lot of academics and me reading it, but a lot of academics have found that when you have paid family medical leave for people of all genders, it actually lowers the very significant wage gaps between moms and non-moms. And they are big. These wage gaps are big, people. Moms are 80% less likely to be hired than non-moms for the same job, and dads are actually more likely to be hired. Dads are offered $6,000 more in starting salaries for highly paid jobs. Moms are offered $11,000 lower salaries for highly paid jobs. And again, this is the same resume, the same job experience, the same human, the same piece of paper. So this is flat out discrimination. And this flat out discrimination can be stopped in its tracks by having policies that include paid family medical leave, access to health care, which Donald Trump and Republicans just eviscerated. I just have to say that. Access to affordable childcare, also just eviscerated by Republicans and Donald Trump. Have to say that. And fair pay policies. So some countries, as we talked about a little bit ago, most countries on the planet Earth have this policy in place. And because it's such a promoter, this policy, paid family medical leave, of pay equity, they actually offer a bonus amount if dads take paid family medical leave, because it helps the economy, because women make the most consumer purchasing decisions. So, you know, if we have better pay equity, then actually we have a better GDP. So what's your take on that? That it's actually better for everyone, better for the economy when we have dads taking this policy?
Yeah, one of my favorite stats we figured out during the Build Back Better fight is if we were to pass policies like paid family medical leave, if we were to invest in affordable childcare and long-term care, things that kept more women and men in the workforce over the longer term, it would actually yield millions of jobs, billions in wages, and trillions in GDP. So it is critical, as most of the world has learned, not just to individual families, financial security and peace of mind, but to our economy and to making it grow and stay competitive. And as the sandwich generation continues to grow, meaning people taking care of both kids and aging parents and other loved ones, this crisis is only going to get worse. And if we don't do something about it, America will fall behind as a result.
We have 2 minutes left. And I love that you said, if we don't do something about it, America will fall behind. Hello, I agree. Of course I agree. What should we be doing about it? We're in a moment of crisis. As we started this interview, we're talking about the headlines being absolutely bleak. We're talking about Donald Trump and Republicans in Congress doing fake paid family medical leave, which just nauseates me because they're trying to check a box and think that we're not reading the fine details. Yes, we're reading the fine details. So what should people do about it?
So many things to do about it. Don't give up hope. First of all, I would say, take a little bit of time to be with your families tomorrow and to relax, because you got to stay strong for the long fight. The thing I'm thinking about immediately that I want to do is to make sure everyone knows what is in this bill. Some of the effects will not be felt until after the midterm elections. So we need to make sure we are telling everyone in every way possible exactly what has been passed, what your electeds voted for if they did, including things like fake paid leave that is just another giveaway to the wealthiest big businesses, nothing to do with expanding access to paid leave. Letting them know about the healthcare, the loss of SNAP, the loss of simple things that has kept our communities together for years, the small social safety net that we have, but vital. So I think we need to be going and doing billboards in every district. I think we need to be doing radio shows constantly and talking about it. I think we need to be doing town halls and earned media and paid media, and that we all need to stay engaged in this through the midterms and well beyond, and make sure we are voting, we are using our voice, we are being as loud as we can.
In other words, the vote that happened recently where Republican leadership and Donald Trump eviscerated healthcare, childcare, SNAP, public education is not the last word. The last word is us. There are so many of us, so many of our votes. So make sure you're registered to vote. Make sure you make a plan to vote. Yes, we know it's not for a long time, but we are already planning over here because that vote was ridiculous. It undermined the economy. It undermined our families. It was painful to our country in very real ways. And we must continue to persist, rise, and change our country so that everyone can thrive. Yeah. Thank you so much, Dawn. Thank you for being on.
And on a sad day before the 4th of July, but we are going to fight this cruelty, and glad to be in the fight with you, Kristen.
Thank you. Thank you, Dawn. Glad to be with you too. Well, that's it for our show today. Thanks for tuning in as we tackle the top topics facing our nation in a way that requires the most boring disclaimer in the history of the actual planet Earth. Here goes. Views expressed on this show are those of the individual speakers and should not be attributed to MomsRising, to this station, or to any news or social media service that may disseminate a recording of this show to the public or to any segment of the public. Boom! We'll catch you next week.